This video covers 5 common mistakes to avoid when you're trying to lower high blood pressure. Lowering high blood pressure is important because it helps reduce your risk for things like stroke, heart disease, and a heart attack. And be sure to stay till the end because I share a tip that could save you a trip to the emergency room. As a geriatric physical therapist, I have seen firsthand the negative downstream effects of these health conditions, and it's so much easier to prevent and reverse them in the early stages. And unfortunately, your doctor may have just given you the advice to eat less salt, or to lose weight, or to walk more. And that kind of advice isn't always very helpful. That's because what really causes high blood pressure is high levels of insulin and insulin resistance. I'll link to a video on the end screen that explains 5 connections between the two. And most doctors aren't even testing for insulin resistance. Fasting insulin is not even on a standard blood panel. And this study showed that 88% of adults in America have some degree of insulin resistance. So the first big mistake people make is to fail to recognize that high levels of insulin will lead to high blood pressure. Once you realize that insulin is a key hormone driving high blood pressure, it opens up an entire new toolbox of strategies that you can use to lower it. The second mistake people make when trying to lower blood pressure is overemphasizing macronutrients and overlooking sodium. Macronutrients are nutrients that we need in large quantities. These include carbohydrates, which really aren't essential, protein, and fats. Micronutrients are nutrients that we need in smaller quantities. These include vitamins and minerals. One important mineral to pay attention to when you want to lower your blood pressure is sodium. Excess amounts of sodium can increase water retention and thus blood pressure. The recommended amount of sodium for someone with high blood pressure is 1,500 to 2,300 milligrams. Now, this will depend on your health condition, climate, and physical activity levels. If you're only paying attention to macronutrients, you may not be paying attention to the quality of the macronutrient or the amount of sodium in the food. For example, my favorite double cheeseburger from Runza doesn't look too bad for insulin when you're just looking at macronutrients. Now, keep in mind that fat has the lowest insulin response, protein is moderate, and carbohydrates, specifically starches and sugars, have the highest. It has 670 calories, 40 grams of fat, 25 grams of carbohydrates, only 3 grams of sugar, and 46 grams of protein. But it also has over 1,000 milligrams of sodium. And if you're pairing that with a side of fries, you're likely having close to an entire day's worth of sodium in one meal. Another example is deli meat. Just 2 ounces has 50 calories, 1 gram of fat, 2 grams of carbs due to the added sugar. Yes, they added sugar to this deli meat, and 9 grams of protein. In just one serving, there's 500 milligrams of sodium, and we recommend you have at least 30 grams of protein per meal to support healthy muscle. Let's be conservative and say you have 3 servings of this deli meat to get 27 grams of protein. We also have to take the sodium amount times 3 too. So if you're putting 6 ounces of this meat on a sandwich or salad, you're actually getting 1,500 milligrams of sodium, an entire day's worth for someone trying to keep their sodium low. Some of you may see the 2 grams of trans fats on this cheeseburger label and be concerned about that too, which brings us to our third mistake, which is thinking that you can't have any trans fats. Natural trans fats are not the same as the industrial trans fats that were banned by the FDA in 2018. The industrial ones were banned due to their association with cancer, diabetes, and heart disease. One study found that 5 to 10% of the fat in beef is natural trans fat. Now, there are 40 total grams of fat in this double cheeseburger, so 40 times 0.5 is 2 grams of trans fat. Conjugated linoleic acid, or CLA, is a type of natural trans fat. It's produced by microbes in the first stomach of ruminant animals such as cows, pigs, goats, deer, and sheep. So you eat natural trans fat when you eat meat or dairy products from ruminant animals. This article stated that natural trans fatty acids such as CLA can help lower blood pressure and insulin resistance. The best natural food sources of trans fat CLA are grass-fed beef, butter, and full-fat dairy. The types of trans fats you want to avoid are in processed foods such as crackers, chips, and fried foods. As I've mentioned in other videos, the high heat required to refine the canola and soybean oil used for these products increases the trans fat in the oil, and the amount of trans fat in the oil increases with every time the oil is used for frying. The third big mistake is overeating added sugar. This includes natural sources of sugar like honey, maple syrup, or agave. These natural sources of sugar will not always be on the added sugar line, but they will be included in the total sugar line of the nutrition label, so be sure that you're looking at the total sugar line and check your ingredients. There are a lot of sneaky names for sugar. Some include dextrose, syrup, glucose, fructose, high fructose corn syrup, and all of the other ones listed on this slide. All of these will spike your insulin, which will increase your aldosterone and increase your salt and water retention, which will increase your blood pressure. The American Heart Association recommends having no more than 24 grams of added sugar per day if you're a woman, or 36 per day if you're a man. But obviously the less the better, because this can add up really quickly. For example, 1 tablespoon of honey in your coffee or on top of your oatmeal has 17 grams of sugar. Coffee creamer is another big source of added sugar. I used to have this peppermint mocha creamer, and I would have 2 tablespoons of it in each cup of coffee, and then I would have 2 cups of coffee per day, which is 4 tablespoons of coffee creamer, and there's 5 grams of added sugar in each tablespoon, so I was already getting 20 grams of added sugar just in my morning coffee. The fourth big mistake people make when lowering blood pressure is not exercising at a high enough intensity. I see a lot of people walking, but are they really going fast enough to get their heart rate up? And they aren't sustaining the exercise long enough to get the full benefits that they could. They are already there doing the work. They are so close to the benefits, but just need to work a little bit harder and a little bit longer. Now, any movement is better than none. All forms of exercise will help lower blood pressure, so that includes resistance, cardiovascular, and flexibility. But you'll see the most benefits with cardiovascular exercise. These include things like walking, jogging, dancing, swimming, biking, or elliptical training. It's important to sustain the activity for at least 20 minutes, preferably closer to 40, at least 5 days a week for maximal benefits. And intensity does matter, so work at a moderate to vigorous intensity. Now, beta blockers like metoprolol blunt your heart rate response. This makes using heart rate monitoring ineffective, so you'll have to rely on your symptoms, and moderate intensity is when you can carry on a conversation in whole sentences or short phrases. So your breathing rate increases and you may start to notice some mild sweating. And vigorous intensity is when you can only speak in single words or very short phrases. You're breathing heavy and sweating more. So next time you're on a walk or at the gym, check your intensity. Is it actually harder for you to talk? Are you actually noticing an increase in your breathing rate or your sweating? Are you sustaining the activity for at least 20 minutes? If not, that means that it's time to work a little bit harder or a little bit longer. The last mistake I'm about to share with you can actually save you a trip to the emergency room. Often when people are working to change their lifestyle and lower their blood pressure, they don't realize how fast it can happen. If you're taking a medication to lower your blood pressure, there's a risk that that medication can overshoot. It's important to check your blood pressure on a daily basis if you're taking blood pressure lowering medications and implementing lifestyles to lower blood pressure. Be in communication with your physician and ask for hold orders. This means check your blood pressure before you take your medication. If the top or systolic number is below a certain number, or if your pulse rate is below a certain number, then you would hold the medication, you wouldn't take it. So common examples are if your top number is under 90 or if your pulse rate is under 60. But this needs to be a personalized recommendation from your physician. One of our Zivli members was able to get off of her blood pressure medication within just a few months of changing her diet. So be on the lookout for signs and symptoms of low blood pressure, including cold, clammy skin, lightheadedness or dizziness, anxiety, fatigue, trouble concentrating, a weak but rapid pulse rate, confusion, fainting, nausea, or blurry vision. If you're experiencing any of these while you're making lifestyle changes to lower your blood pressure, it could be a sign that your current medication dosage is too high. Having this conversation proactively with your physician gives them a heads up. It will lead to less resistance from them for lowering a medication dosage or getting rid of one altogether. It will also give you more peace of mind to first consider low blood pressure before jumping to concern that something more serious is happening if you're having those signs or symptoms. So let us know in the comments what your blood pressure is and what you're trying to do to lower it. We always like hearing your comments and your insights and takeaways. And be sure to click below for more information about our coaching if you need personalized help to lower your blood pressure. Now watch this video next about the 5 ways that high insulin leads to high blood pressure, and check out this video about 7 simple steps to lower your blood pressure quickly and naturally. And as always, please take a moment, show your support for this channel, and subscribe. Thanks for watching, and I'll see you soon in another video.